welcome to another great one-on-one interview about how people are managing their condition effectively with Lympha Press. I met a new friend at the FDRS conference in April, and her name is Unstoppable Molly. Unstoppable Molly, how are you today?
I'm wonderful. Thank you so much.
I loved meeting you, and then to find out that you are a Lympha Press user. How did that journey begin?
Oh, I started seeing Dr. McHutchison, Lindy, as she likes to be called, but I still can't get over trying to call her Lindy because I have so much respect for her knowledge and experience. She diagnosed me and was able to, help me with my conservative treatments to start off, and had those documented. And she told me about the Lympha Press as an option. So I read about it, and then I went online and I learned about it, and was excited to see if I could actually get one. And so she helped me with the paperwork and everything, and was able to get it approved through my insurance. I only paid actually a very small amount, because I'm really privileged and lucky to have the insurance that I have. And I definitely think the representatives from Lympha Press, from what I understand, if you have trouble getting it approved, that you can talk with them as well and they can help you. But I started using it, I guess it's been a year and a half now. And I don't like to go without it at all. It really makes a difference.
Well, tell me how it makes a difference. And then I want to go into your backstory of how you got to the point of getting a diagnosis. But you
Mhm.
got your Lympha Press, you had learned about it online,
Mhm.
you started using it. Was it easy?
Yes, it was super easy. So first I got this giant box in the mail, because I'd seen the pictures of it, I'd seen a couple of videos, but I didn't quite know what it was going to be like. But I got this giant box in the mail, and the instructions were to wait until I had somebody come to show me how to use it, which was a huge relief because when the representative came by and we opened up the box, it was like so many, it seemed overwhelming to me, right? But the thing is that having somebody just show it to me, I was able to see how simple it actually is, but I was glad that I had somebody there with me. But basically, what I like about it is I think of it as almost like a sleeping bag. Mine are pants, but I unzip it at the top and at the sides, and I just sit down and I slide my legs in and I shimmy my way down. I have the Lympha pants since they go all the way up to my chest. And the representative helped me choose, which, they had a prescription based on like what the compression should be, but he's like, let me, we can start light and just see how it feels and things like that. So that was really helpful too, and walked through all of the different functions. There's ways of turning on and off different channels. So like for me, I'm 4'11", so my legs are really short and they don't go the full length of the pants. So what we did is we actually turned off the bottom few chambers because my feet don't hit there anyway. And it really helps because basically the compression starts just at my ankles and it goes up. So yeah, I felt really supported in that. And there was one time where I accidentally, I don't know if I'd done it with traveling or what exactly had happened, but somehow I disconnected one of the hoses, like the thing broke off. And I was so upset. And because I was like, I don't know what to do. I can't imagine. But I called and got through like right away. It was very easy and explained what happened. And they said, okay, well, here's the instructions for sending it in. So I did actually have to send it in. I sent it in and they repaired it and sent it back to me. There wasn't any charge and I didn't have to pay for shipping or anything like that. But I didn't have it for 4 days. And I think that at that point, and I've been using it every day, sometimes twice a day for an hour each time. And I felt like it was working, but you kind of get used to your new normal. But in that time when I had 4 days that I went without it, and I should say that the rep was apologizing to me that it was a Labor Day weekend. So it was going to be like a longer weekend that I would go without it. And they apologized to me and I was like, I was just really surprised because I was thinking it might take like 2 or 3 weeks to get it repaired and everything. but I got it back in 4 days. But during those 4 days without it, my legs felt really, really heavy, really swollen. I had trouble pulling up my compression over my legs. I was still trying, like, I did my vibration plate every day. I did my recumbent bike. I would do legs on the wall, where you put your legs up on the wall to kind of help try to get some of that fluid out. But I was still having a lot. And then obviously, like, the stuff that we all do with like the manual lymphatic drainage and stuff. And it felt like it just wasn't touching it. So then I got my pump back, and what I decided to do was measure my legs before I used it for that first time when I got it back. And I measured them in each leg in 3 different places. So I did like the top of my thigh, just over my knee, and then my calf. And in both legs together total, what I did is I measured before, and then I measured after. So when I measured them again after, I had lost a total of 4.5 inches total from both legs. And like, I felt like, I was joking with my spouse, my husband, because I was like, I actually marked on my leg where we did the measurement and everything, because I wanted to make sure that I was actually accurate and everything, because you know how sometimes you can do it slightly different. And it was as accurate as I could get it, but it just showed me how much it really did get out, and then it was like running to the bathroom, peeing a million times, and all that stuff,
That's the sign that it's working.
I know, exactly.
That's
exactly.
Awesome.
Exactly.
I so appreciate your story. First of all, you touched on the fact that you don't just get a box and are meant to deal with it. Yeah. We offer support to show you. We'll even walk you through your first treatment. Absolutely. I love you mentioned that you traveled with it. You even brought it to FDRS, which is super cool. And on the rare occasion when something happens, there is support there to help make sure you're getting your therapy you need back at your home as soon as possible. So those were 3 really high points, and we're so glad you mentioned them. Tell me this, though. Sometimes the women I speak with have quite a journey before they even get to a diagnosis. Mm-hmm. Can you relate to that?
Yeah, I mean, so I think it's complicated for everybody. But when I was always just a beanpole until I hit puberty, like so many, with lipedema. And what happened was like pretty much overnight, all of a sudden I had, what we call thunder thighs, or like, chunky thighs or whatever. And it was, it's just definitely like heavier in my legs. My legs always just look different. And it was really just from the knee to the hip. There's a lot of women and people who have it in their lower legs, but I really just had it from my knee up. And I was like so many people's stories, right? I was incredibly active. I also have PCOS. So like I had, weight was easy for me to put on for that reason too. And so I used to exercise just almost compulsively, and I ate very little for years and years and years. And I always compared my legs to other legs and was like, just confused. My legs were always strong, like really, really strong. And when I did I did weight training type classes in college and like things like that, they were always amazed by how much I could do on the like leg press. Like it's ridiculous. It's, several times my weight, even without like working up to that, and anyway, so I was always a runner. I did a lot of dance. I did all of these different things. At some point I was diagnosed with PCOS, and I was like, well, that must be why my legs are bigger, and that must be why I can't lose weight. So, dealt with PCOS for a really long time. I had a lot of other random things that I've just learned in the past month or two are actually related in some ways, or like they're frequently co-occurring things to lipedema. And I feel like if I try to go down that road, it'll be we'll be on the phone for a really long time. But the bottom line was for me is that I found this doctor in 2014, Dr. Eric Westman, who teaches using a ketogenic diet that is based on research and his research, clinical research. And with his help, I was able to reverse all of my symptoms of PCOS. And I was able to lose weight for the first time in forever, and all of these amazing things. But my legs never got smaller. I had a certain point and I just could not lose any more weight. The weight I couldn't lose was definitely my legs, upper legs, my thighs, my butt, and my chest. And he was kind of baffled. Like a lot of times women will lose weight first in their chests. What happened for me is that my band size went down, several sizes. My cup size was bigger because there was a bigger difference. And so then that became really tricky to try to find bras or like things like that. But it's the difference between your waist and your chest. And if you're not losing any weight in your chest, your cup, then that's why. But anyway, I was frustrated, but I also was like feeling better for the first time in a long time. So I had some hormone therapy about, let me think. It was just before the pandemic. So it was like about 2.5 years ago. I had hormone therapy, and it included progesterone and estrogen. And almost immediately I started to have leg pain. And my legs started to swell up really badly. And I started to have these weird symptoms where it felt like a whooshing of fluid, that just didn't feel right. And I was having leg cramps. And I had never had pain in my legs before. I mean, they always felt big and kind of heavy. But I never had that happen before. And what was starting to happen too is just that the legs felt so heavy, like just so heavy. Like I was just trying to move around a cement blocks basically. And my energy was much lower. And then
I just want to say that, here you are, a person that's doing everything to try and improve how you're feeling. And the ketogenic diet for you helped a lot. But then here you are taking hormone therapy again, because you want to improve how you feel, and you only get worse.
Yeah.
I feel for you, because that had to be such an emotional blow as well.
It was very emotional. I think I was just kind of in shock, but I always joke, and I used to joke that it was like this for me, but now I know it's like this for an entire community of other people, which is what is one of the wonderful things about, social media and the lipedema community, is that you learn that you're not alone. And one thing I learned that I'm not alone in is that I always used to say I was the wrong kind of 1%er. Like there's the 1%ers who get to fly to the moon with their extra change. And then there's the 1%ers who would probably throw off any clinical trial. Will have like all of these random symptoms and issues that people don't even know are, related. So I have interstitial cystitis, which I guess is commonly something that happens with lipedema. I have a subclinical form of POTS, which is basically I don't meet the criteria, but close. And that's been going on for 20 years. And I was told, and I was thought it was anxiety. And it never made sense to me that I felt anxiety when I go on walks, but that's when I have these dizzy spells. And so for 20 years, I thought, I need to meditate more, take, different anxiety medicines and all these things. And found out through the lipedema community just recently that POTS is a very frequently co-occurring, and subclinical POTS can feel like that, where you go for a walk for 20 minutes, 30 minutes, and you start to feel like you're going to pass out.
But did you stop the hormone therapy?
Oh, I did. Oh my gosh, I'm so sorry. Got to get back to that part.
No, I'm just intrigued because, I had interviewed many women, and we often see the hormonal juncture where lipedema presents. And you said really at puberty at first, but then introducing the hormone therapy is exacerbated what was there. Almost in a way, I hate to say it this way, I don't want to be trite, as a blessing, because it might have led to your diagnosis.
Yeah. Otherwise, I don't know that I would have progressed until menopause. So really what the hormone therapy was for fertility treatment. and it did not work out. But what ended up happening is that I was in so much pain that I was like, okay, I'm not going to continue with this. This is doing something to my body that is not okay, and it's not helping. So I stopped the hormone therapy. The pandemic happened, everything started to shut down. I got a new job, and within the first week of my new job, I was having this really severe leg cramping, and specifically in one spot. And I called, my doctor who had prescribed the medicine to say, what, is this something I should check out? And they said, well, with the amount of hormones that you were on, it puts you at really high risk for blood clots. So you do want to go in and get an ultrasound on your leg. And so I went ahead and tried to get in everywhere, but and I live in North Carolina, where I'm surrounded by some of the best health centers in the world, but nobody was taking patients. Like nobody was, especially vascular type things, because of COVID. Everything was closed, and I got to being told to go to the ER, but I didn't want to go to the ER since it was like, everything you were hearing on the news and everything. So I kept on calling around, and then I remembered that there was this place called Carolina Vein Center, and it's right around the corner from my house, and I drive by it all the time. And I was like, okay, well, they said that it's something in your veins. I'm like, let me try to call them. And I honestly always thought vein issues were cosmetic, and that it was something that kind of gets pushed on women as like, ooh, your veins are showing or something like that as you get older. And it just didn't seem to be something important to me. So I didn't really think about it. But anyway, so I called them and they weren't open, but I left a message and I got a call back within like 30 minutes. And they said, we are closed for COVID, but we consider this to be an emergency. We do emergency ultrasounds and we open just for that. So I'm so sorry, because it's going to take us about an hour or two to get all the staff here and to get it set up for you to come. But if that's okay, and I'm like, oh my gosh, like, yes, please. I mean, if I had gone to the ER, it would have been 7 or 8 hours and exposed to COVID. And I mean, such a nightmare. So it was really just a blessing. And
I gotta say that Dr. Lindy McHutchison is in the forefront of lipedema diagnosis, treatment, patient care, and we are so honored to work with her. She's an amazing human being, and I'm so glad you mentioned her by name here, because that's the kind of, see, it's about heart too. She's brilliant, but she has a heart for her patients.
Yes. I mean, it was phenomenal, because I mean, I was nervous for so many reasons. And for her to squeeze me in that quickly, and they just did it really quick. I mean, it was amazing how quick the ultrasound was. And, she came in and she said, hi, I'm Lindy. And I was thinking, and she's like, well, I'm Dr. Lindy McHutchison, or what, and she's like, but everybody calls me Lindy. I mean, can I call you by your first name? And, and I was just like, oh my gosh, like, this is so refreshing. But that's how she is. And she sat down, like, she didn't come in and like stand up and talk at me with her clipboard. Like, she came and sat by me and talked to me. And it just makes such a huge difference. And I really feel like I lucked out in a million different ways. I feel like it shouldn't be that rare or lucky to have a story like that. What I would love to see is really compassionate providers learning from, Dr. Lindy, and being like, you know what, like, this is important and this matters. Because I can tell you, I mean, I've referred so many people to her that they've probably gotten overloaded multiple times, but people travel from all over, the East Coast, especially like the Mid-Atlantic area, to get to her, because that's how few people diagnose and treat, but also her compassion. She's always been so compassionate, and she jokes because she's like, I'm really tiny, like I'm thin. And so I know that coming from me, it might seem, trite or something like that, but, like, you are doing a great job. Like, you look wonderful. Like, she's very affirming and validating, and not at all judging of my body in any way, which I think with women with lipedema is, I mean, just so important, and lymphedema as well, obviously.
Absolutely. So you received your diagnosis then?
Yeah. So, well, actually, she said to come back and would do that separate, because I think she wanted to do like a full thing, and they had just opened for the emergency. So I did come back to officially get it. But that appointment, she said, "Have you ever heard of lipedema?" And I was like, "No." And I have to tell you, like, initially when I saw the brochure, and keep in mind, like, I was still feeling like all of this stuff was still cosmetic in a way. Because what she talked to me as that I had, like, basically it's like my veins were overloaded and collapsing, and I needed to have vein procedures done. And my thinking is that the hormones really fast forwarded and progressed what was already kind of happening, like, underlying, because we know that with lipedema, your body's trying to get out this fluid and it can't, and it's just kind of overtaxed. But I also think that the hormones somehow play a part in this. And what I used to think was cosmetic, or, I remember hearing one of my aunts say, "Well, I have vein issues, but it's because I'm a nurse, so I'm on my feet all day." And then she's like, "And your aunt Ann, she has, vein issues because she's on her feet all day because she's a teacher. And then so-and-so has vein issues because they're a secretary, so they're sitting all day," right? And you're like, okay, these are like the three professions that women had for many years. Like, what if it's that it's not about whether you're standing too much or sitting too much, but instead it's about the way that it's the hormonal impact on your veins and your fluid. And I don't know how it all works. Somebody else can study it, but I think that it's more about that, and it's less about cosmetic, because it's pain. It's very painful.
Whenever we talk about the Lympha Press, we don't talk about reduction. We talk about increased mobility, reduced pain, and that word pain, people sometimes think of as this sharp kind of feeling, but oftentimes it's just that heavy ache that exists. So if anybody watching, if you're hearing yourself in Molly's story and you're discovering that you might have lipedema, you can find somebody to diagnose you and get started on a protocol. So is that what happened? You got started on a protocol? And what was your protocol?
So they did the vein procedures over time. And she started having me wear compression that day. She said, "You need compression right now." She gave me a pair of leggings to start with, and then gave me, a ton of different resources to check out. In my lipedema appointment with her, she went over, so much information. It was amazing, and it was also just a lot of information all at the same time.
On the one hand, you might have felt overwhelmed by all these different things that you could do, while also being kind of excited that, wait, there are things I can do.
Yes. And I think that it was really helpful to have both. Like, I think if I had only heard the this is progressive, you may lose mobility, like all of those things, like, I think that it would have been incredibly overwhelming and depressing. But instead, it was really helpful to, first of all, feel validated, to see the pictures in the brochure, where it was like, oh, that's what my legs look like. Like, this is not just that I have bigger legs, and this is not because of PCOS, and this is, and knowing that everything that I did where I was so obsessive was, was not going to work. It wasn't on me. It wasn't something that I had control over, which I think a lot of times people don't realize how powerful that is, and how much pressure we put on ourselves when there are things that are well outside our control. Dr. Westman, the first time I saw him, the first thing, and this was before I was diagnosed with lipedema, but the first thing he told me was that it's not your fault. And I just sobbed, because I'd never heard that. I've been, body shamed by so many doctors. I had so many bad experiences. And he, at the time he said, well, you have PCOS, you're insulin resistant. And, I was raised vegetarian. I was eating a very strict vegetarian diet, but I was also eating very little. But I wasn't eating the right things for PCOS, I was eating a lot of sugar, not like actual sugar, but like pretzels and fruits and, all of these things that I thought were so healthy and were not helpful.
And I will interject that every body is different.
Oh yeah, sorry.
Different bodies. No. This is my job to do that. Everybody's different.
Yeah.
You may try some of the things that Molly has tried and it may not work for you, but there are other things to try. Of course, we always recommend trying the Lympha Press.
Absolutely.
Because honestly, I have not met one woman with lipedema that it hasn't helped.
Yeah.
But anyhow, back to your regularly scheduled story. Go for it, Molly.
Yeah. Well, and what I was going to say too is that even with my very strict diet, I progressed rapidly, which is what I know now, right? My diet didn't change, but my body absolutely did. And it was just my body not being able to handle the hormone therapy, essentially. But hearing that it's not your fault, I think is such a powerful thing. And it's almost always something that I want to share anytime I talk to another patient, even other women in general, but especially lipedema patients, because I feel like so often that message is not what we get. So, I think it was powerful to know that I wasn't alone and to have all the resources. And then I'm very proactive, which I think a lot of us are in the community. And, I immediately started looking up, learning about the vibration plates that were available and different kinds of compression and, all of these things. And again, like once I got the Lympha Press, it took about, I would say it took like maybe two months because I'd already started the compression, but which point Dr. Lindy was able to say, like, she's been doing conservative therapy for 3 months because that's what my
and that is an important component, making sure you're doing your exercise, elevation, compression.
Yeah.
And then the insurances can see that despite those conservative measures,
exactly,
you're not getting improvement.
Exactly. And even with the like vein treatments that I had done and things like that, it was like I was still, what Dr. Lindy said is that with, somebody who doesn't have lipedema, if you do the vein surgeries, you can have like really amazing results where you just don't feel any pain or discomfort after that. But when you have lipedema, she said that, it's not like she can put an absolute number on it. But the way that she hears from patients, what they give her feedback on is that it improves it about maybe 20 to 30%. And that's about what I felt. Almost, that's like almost exactly what I felt, is about like 20-25% improvement. It was worth it. But then once I got the pump, then that brought it up. And so as long as I use the pump in the morning, I can, first of all, get my compression on, but then second of all, I can, do things and walk around, and I feel pretty good. I start to feel it after I've been sitting for a long time. And so, midday, I would do vibration plate and ride my recumbent bike to kind of help preserve it, like, be like, like we're going to keep it here.
It's called maintenance, managing, and just like a garden, it's beautiful, right? But you got to take out the weeds and you have to water it and fertilize it. And it's taking care of your body, doing what it needs to stay on top of this so that lipedema doesn't control you, you control it.
Right. Exactly. And I think that, when I use it, if I have something that I know I'm going to be standing for a long time or sitting for a long time, I'll use it twice in a day. So I'll use it in the evening too. And it's so amazing how much of a difference it makes. Because, and I guess it's hard to tell if you've never felt it, but that feeling of heaviness and aching, it also kind of just feels stuck. And just like your legs just don't want to move. And it's really hard to describe it if you haven't felt it, but what happens is that it feels almost like it just kind of loosens up that solid block. And then you're able to move your legs better and walk around easier, and all of those things. It makes a really huge difference.
Which makes us so happy because we genuinely are rooting for you. And we love, that's why when I met you and we talked, I'm like, we've got to do an interview with you. So you can follow Molly Gallagher at Unstoppable Molly on Instagram. And when I look at your description here, you use a hashtag Lipedema. Do you also have lymphedema?
Yeah, so I do have lymphedema. Basically, I guess that some of that is why the swelling was so drastic when I didn't have it. So when I didn't have the pump for those 4 days, and then I used it again, there was such a drastic difference that I guess that's more common with what they think of as lymphedema. And then the phlebo part, I guess, is the part of the veins being insufficient and having those kinds of issues, right? So it's like those three terms together. I can't say them together out loud easily.
Neither can I. Believe me, I almost choked on it, but I get you.
It's really tricky. But I think that there's probably more of us that actually do have all three of those things. And at the FDRS conference, Dr. Chen, he was talking about how lipedema and lymphedema are more overlapping than people realize. And I think the research is just not yet done. But it makes sense why it helps so much.
Yeah. So when did you embrace the moniker Unstoppable Molly? I think of Unsinkable Molly Brown.
Yeah.
But you're Unstoppable Molly Gallagher.
Yeah. So, well, I love Unsinkable Molly Brown from, that whole story is just so amazing from the Titanic. For me, Unstoppable, I think it's that idea that people report that it is progressive and there's no stopping it, right? And to me, I'm saying there's no stopping me. So I'm going to keep on pushing, and I'm going to keep on finding ways to make myself feel better. And I'm going to take an active role in my care, and I'm going to help other people do the same thing. So, and I think that I'm a very private person, and I never thought I would do the, Instagram thing and, create this profile. And, just even going to the FDRS conference was stepping outside of my comfort zone in a lot of ways. But I have talked to so many other patients who are feeling like they've experienced lipedema stopping them from doing things they love. And my whole goal in sharing is to let people know that they are not alone, and let's find different ways that we can push past this so that we can all be like unstoppable, and that this, this disorder or disease, whatever it is, that it just doesn't get in the way of us living our lives.
So I normally end every interview with, if you could encourage someone watching out there, but you just did. Oh. I mean, I don't think I could say it any better, but is there anything left unsaid in this interview? Because I think it's, first of all, such a joy and a privilege to connect with you, to get to know you personally. Hey, you've been to the roundtables?
I have. Yeah, I go, I'm usually lurking. Like I said, this is me just starting to realize how important it is to share your story. Like, I think before I thought, I don't know, like I never thought about it really. But then just really seeing how much of an impact it can make, I was like, I need to talk about it. And, even if, one person sees a post and says, hey, my legs, I always felt like my legs were a little bit different than everybody else's, or my legs hurt. Or even if they don't even have lipedema and they're just saying, you know, my legs are aching. I don't know if I should go to a vein doctor or a vascular doctor because that's cosmetic. Just helping people to realize that it's not cosmetic. This is a real thing. It's not your fault, and you're not alone.
Unstoppable Molly, thank you for your time today.
Thank you. I appreciate it.
We appreciate you. And we also want to encourage anyone out there, if you've been touched by Molly's story, follow her on Instagram at Unstoppable Molly. And if you want to know more about what Lympha Press can do for you, reach out to us, marketing@lymphapress.com. It's been a pleasure, Molly, and I hope you have an amazing day.
Thank you. It was so
I'm going to keep following you because you're awesome. You're unstoppable.
Thank you.